0.4 to 10,000 people. And of course, too, 12.5% of Nigerians have one form of psychiatric disorder or another, which is about 21.1 million Nigerians, and that's quite a lot, Justin.
Yes, it is. You can imagine that a lot of us have one mental issue or the other and might not even know it. So that's why World Mental Day, October 10th, is a day for global mental health education, awareness and advocacy against social stigma. Yes, a lot of times people have been stigmatized, especially when you hear that there's a madman or this family that has history or trait of madness in their house. People tend to not want to associate with that particular family.
And of course, when people talk about mental health, some people, like to link it to spiritual issues.
Yes,
and I guess that's why, a lot of times people are stigmatized. And like you did point out, a lot of people suffer from this. Yes. And that's why when Nigerians, they ask a common Nigerian, how are you? And they say they are fine. I begin to ask sometimes, are they really fine?
They're really fine. They just give you the cliched, response. All right, it was first celebrated in 1992 at the initiative of the World Federation for Mental Health, a global mental health organization with members and contact in more than 150 countries. This day, each October, thousands of supporters come to celebrate this annual awareness program to bring attention to mental illness and its major effects on people's life worldwide. Let's take a quick time out and give you a bit of a background and information on mental health, and we'll come talk to our doctors.
Did you know that every year, 1 adult in 4, along with 1 child in 10, will have a mental health issue? These conditions can profoundly affect literally millions of lives, affecting the capability of these individuals to make it through the day, to sustain relationships, and to maintain work. Today we celebrate World Mental Health Day. World Mental Health Day was first celebrated in 1992. The goal is to help raise mental health awareness. Each of us can make a contribution to ensure that people dealing with problems concerning mental health can live better lives with dignity. The stigma attached to mental health causes a damaging, albeit ill-informed, attitude, making it more difficult for those affected to pursue help. The best way to deal with this stigma is through facts and a better understanding of mental health problems. From identifying the causes, pinpointing solutions, and ultimately recognizing what we are really dealing with. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Adolescence and the early years of adulthood are a time of life when many changes occur. For example, changing schools, leaving home, and starting university or a new job. For many, these are exciting times. They can also be times of stress and apprehension. However, in some cases, if not recognized and managed, these feelings can lead to mental illness. Depression is the third leading cause of mental disorders. Early warning signs of mental health disorder include eating or sleeping too much or too little, pulling away from people and usual activities, having low or no energy, feeling helpless or hopeless, smoking, drinking or using drugs more than usual, feeling unusually confused, forgetful, on edge, angry, upset, worried or scared, yelling or fighting with family and friends, experiencing severe mood swings that cause problems in relationships, having persistent thoughts and memories you can't get out of your head, hearing voices or believing things that are not true, thinking of harming yourself or others. The most common types of mental illnesses are anxiety disorders, mood disorders, and schizophrenia disorders. Anxiety disorders are the most common type of mental illness. The individual has a severe fear of anxiety, which is linked to certain objects or situations. Most people with an anxiety disorder will try to avoid exposure to whatever triggers the anxiety. Examples of anxiety disorders include panic disorder, phobias, obsessive compulsive disorder (OCD), post-traumatic stress disorder (PTSD). Mood disorders. These are also known as affective disorders or depressive disorders. Patients with these conditions have significant changes in mood, generally involving either mania, elation, or depression. Examples of mood disorders include major depression, bipolar disorder, persistent depressive disorder. Schizophrenia disorders is a highly complex condition. Schizophrenia normally begins between the ages of 15 and 25. The individual has thoughts that appear fragmented, and they also find it hard to process information. Treatment of mental health disorders are psychotherapy, medication, self-help, which is basically lifestyle changes such as reducing alcohol intake, exercising, sleeping more, and eating well. Positive mental health allows people to realize their full potential, cope with the stresses of life, work productively, make meaningful contributions to their communities. So if you notice any abnormalities with you, seek help today. And remember not to stigmatize against anyone who has mental illness.
Alright, welcome back. It's still Galaxy today and it's World Mental Health Day. Just a reminder, viewers, be a part of this conversation. Join in by sending an SMS if you have a question or a comment for our doctors. You can also interact with us on our social media platforms using the hashtag Galaxy Today. Alright, we'll start from Abuja. We have Dr. Tayo Daramola. He is a psychiatrist and he joins us to talk on World Mental Health Day, and the theme for this year is young people and mental health in a changing world. Now, Dr. Daramola, let us bring it into perspective. That's Nigeria, now young people. What are the various mental issues that we are likely susceptible to?
Thank you very much. Today being the World Mental Health Day actually has been tagged young people and mental health in a changing world. Young people are particularly susceptible to mental health challenges because according to the psychosocial theory of Erik Erikson, they are at the level of identity versus role confusion. And what does this mean? At this stage, they try to identify who they are. They try to form their own opinions. And they get confused, especially in the role expected of them by the society and where they find themselves. And so this also coincides with the time that many of them leave their home and they try to either go to school or live outside the home. They define who they are. And they are very exposed, especially in these times that we have issues like war, we have hunger and starvation, we have underemployment even by the parents. And so they are quite susceptible to issues concerning mental health. I must also point out the fact that many of the youths have not built, or the parents have not helped to build their resilience. And so they are easily susceptible to mental health challenges.
Right. Specifically, doctor, they are susceptible to mental health challenges. When we introduced the show, we talked about the stigma. These challenges that you talk about, specifically, what are they, and how come there is a whole lot of stigma, associated with people with one mental health issue or the other?
Well, thank you for that. Having mentioned how the young people are susceptible to mental health challenges, I must also point out that the WHO has noted that about 50% of mental health challenges would have become obvious by the age of 14 years. And at the age of 24 and above, there's manifestation of about 75% of mental health challenges that will occur. And so with young children, they are trying to define who they are. Some of them go into issues like substance use and misuse, and so they involve in risky behaviors. They easily are susceptible to accidents, both road traffic and domestic accidents. They engage in very risky practices like unprotected sex. They take a lot of risk, and so this further exposes them. For those that are not having enough social support, they could also take to other vices like dependence on other things aside from drug, And so at this stage, when they are not able to build their resilience, they could manifest with any of the major illnesses. And it's been said that depression is the third leading illness among the youths, while suicide is the second leading cause of death among this age group. And we can see that this is particularly a big challenge the world over. In Nigeria particularly, the issue of stigmatization and discrimination is very, very much with us. We have a lot of issues with even people coming forward for treatment or intervention because of the kind of stigma attached to it. It is difficult when you ask a family that, do you have anybody that has mental health challenge in your family? Most Nigerians will tell you, God forbid. And this is not the situation. There's hardly an extended family where one or two people don't have one or two forms of mental health challenges. It doesn't mean that the person has to be a vagrant walking the streets. It is as simple as having issues with your sleep, issues with your emotions. By the way, I must also state at this point that when we talk about mental health, it is your ability to function optimally with your society without necessarily inconveniencing another person. So it's a concept, not just a definition. And so if we look at it like this, we would know that there are a lot of challenges. Rather than people discriminating and stigmatizing people with mental health challenges, we would rather support and encourage them to use the available resources at our disposal. Discriminating and stigmatizing.
A whole lot of misconception about mental health. Someone could, have repeated case of, outbursts of anger, and some people would just say, okay, that person has something, wrong with him or her. So can we attempt to define what mental health is so that we will be clear on this? Because some people have certain symptoms, but they don't know, they're not sure whether it's mental health or not. So the definition, symptoms, and what are the likely causes of this illness?
Thank you. There are many things that could connote a mental health challenge, like I've said. But when we're talking of, there are diagnostic criteria that one has to fulfill, or conditions that one has to fulfill before you make a diagnosis of mental illness, depending on what diagnosis the person falls into. But suffice to say that any situation or any symptom that the person manifests, before you label the person as having a mental health challenge, it has to be persistent, it has to be pervasive, and it has to be causing distress. It is not that, it's not uncommon for us to be walking in a crowded place or the marketplace and you hear somebody call your name out aloud and somebody quickly labels you as hearing voices of unseen people, which in mental health it is called auditory hallucination. That is not it. That is not it. You have to have this symptom persistently. So it is not just a one-off occurrence. It is something that is repeatedly occurring. It happens in almost every situation, and it is a source of distress to you or your significant others. And so the definition of mental illness is not a rigid definition. That's why I said earlier that we should look at it as a concept rather than a rigid definition. But many other symptoms like hearing voices of unseen people, seeing things that other people do not see in clear consciousness, having beliefs that are not sustainable or beliefs that are adverse to norms that everybody could allude to. There are a lot of them that may connote mental illness in people.
All right, doctor, let's talk more now concerning these mental health challenges, specifically as regards Nigerians and the youths. Looking at the situation that we go through on a daily basis, you talked about the insurgencies and of course the harsh economic realities. A lot of people bottle up a lot of emotions, a lot of anger, and a lot of distress. They don't even know who to turn to. So all of a sudden, next thing we know is that they've taken their own lives. In your opinion, looking at our situation here in the country, what would you suggest that the average Nigerian does? I mean, does he see a psychiatrist, and how often should he see a psychiatrist? Because a whole lot of people believe that once you've gone to see a psychiatrist, you know what I mean, yeah.
Thank you. You see, the mental health team is not just the psychiatrists. And I think if we have an open mind, it will reduce the social stigma attached to the practice. There are different levels of intervention: the primary care, the secondary care, and the tertiary care. At the primary care level, even the community health officers that are properly trained could identify symptoms of mental illness, and so they refer to the next level, which is then the secondary care. At this level, things like anxiety disorders, psychosis could easily be picked and treated. Let me state that even our concept of causation of mental illness has been defective over the years, and people still talk about issues like cause or punishment from the god, or somebody diabolically manipulating you. And long ago, it's been proven that stress plays a common central role in the etiology of mental illness. But basically, there are many factors involved. This includes condition from time that the person was in the womb, the conditions surrounding the birth of the person, the child rearing practices. How did you grow up? What kind of social support do you have? Which environment did you grow up in? What are your belief systems? What stress or stressors have you been exposed to? And so, when we're talking about mental health, it's an all-encompassing thing. And so there are some that will just need the intervention of the clinical psychologist. There are those that will need social intervention. There are those that will need medication. So it's not everybody that has a mental health challenge that must be labeled as having a severe mental health challenge or having to be with the psychiatrist. The psychiatrist just is the, let me use the word, leader of the team in mental health.
So, but how can you gauge the level, primary or secondary? Sometimes I walk on the street and I see a lot of people, they dress scruffily, and, sometimes they communicate well, even if they attempt mentally unwell. There are some people, on the other hand, who might, particularly dress very well, and you talk to them and they just go nuts. So how can you gauge the level, and at what stage should one, be talking to the doctor, psychiatrist, or even the psychologist?
Knowing yourself. When you know yourself, you will know when there is a deviation from the norm. People have different personalities, and so when people, your significant others or people around you, identifies that there is a deviation from what they have always known you to be, then there is need to seek further help. And that's why I talked about these various stages of intervention. The society now, people dress differently. So I wouldn't use the mode of dressing of someone to label as having mental health challenge or not. Fashion is something that over the years has always changed, and you'll be surprised at what people may dress like in the next few years to come. But suffice to say that when the society in which you live identifies that there is a deviation from the normal pattern of behavior in that society, for example, it is not unusual for a Christian of the Pentecostal faith to speak in tongues. Yes, but then by the time somebody who doesn't belong to that faith or to a faith that doesn't even practice such starts speaking in unknown languages, then it could be perceived as a symptom of mental illness. And this that's why I'm avoiding giving a rigid definition of what constitutes a mental illness. But deviation from the norm, as are judged by your significant others who had always lived harmoniously with you, would be a reason to seek help.
How would you gauge the level of awareness of Nigerians about mental health? You're a doctor, how many Nigerians do walk up to you to inquire for information concerning these illness?
I'd basically say it's very low. It's at its lowest ebb. And this is why issues like even the mental health bill has been so difficult to pass in a country like ours. Awareness of the average Nigerian concerning mental health issues is quite low. Even nobody wants to be associated with anything that is seen as a mental health challenge. Even the practitioners, you'll be surprised that people still stigmatize against the practitioner. Oftentimes when I get introduced and they say, this is Dr. Daramola, people warm up to you, but when you tell them that you're a psychiatrist, they become a little more careful with you. And so if the practitioners are stigmatized, then you can imagine what happens to the people that have the challenges. And so our awareness and so use of available resources is very low. Though I must also say that even the resources are not at its best in terms of human resources and even the infrastructural resources.
Dr. Daramola from Abuja. So we'll take a break now, and when we return, we'll talk some more about the subjects. Stay tuned.
Did you know that every year, 1 adult in 4, along with 1 child in 10, will have a mental health issue? These conditions can profoundly affect literally millions of lives, affecting the capability of these individuals to make it through the day, to sustain relationships, and to maintain work. Today we celebrate World Mental Health Day. World Mental Health Day was first celebrated in 1992. The goal is to help raise mental health awareness. Each of us can make a contribution to ensure that people dealing with problems concerning mental health can live better lives with dignity. The stigma attached to mental health causes a damaging, albeit ill-informed, attitude, making it more difficult for those affected to pursue help. The best way to deal with this stigma is through facts and a better understanding of mental health problems. From identifying the causes, pinpointing solutions, and ultimately recognizing what we are really dealing with. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Adolescence and the early years of adulthood are a time of life when many changes occur. For example, changing schools, leaving home and starting university or a new job. For many, these are exciting times. They can also be times of stress and apprehension. However, in some cases, if not recognized and managed, these feelings can lead to mental illness. Depression is the third leading cause of mental disorders. Early warning signs of mental health disorder include eating or sleeping too much or too little, pulling away from people and usual activities, having low or
Hi, welcome back. It's still Galaxy today, and we are still expecting your feedbacks and your messages. Feel free to do so. The numbers will be displayed shortly on screen, just in case you want to talk to our doctors here. And of course, you can join in the conversation on social media using the hashtag Galaxy today. Let us round off with Dr. Damola, so we can go straight to Ibadan in a bit. Doctor, you've talked about depression. You talked about people being suicidal. Let's talk about personality disorders. I just want to find out how if we can relate to that here in Nigeria, because over time we hear people in the West talk about being bipolar, and having multiple personalities. Do we have such, situations? Have any or patients come to you to, and they presented with such, let's say symptoms or conditions?
Definitely, we have patients presenting with, you mentioned bipolar, it's quite common. Personality disorders, we have patients with personality disorders. I must say that the personality of an individual is formed at the age of 18 years. So if the person is not as old as 18 years, then we talk about developmental disorders. And there are various personality disorders that people could suffer from. And a lot of them may require psychological intervention. For bipolar affective disorders like the thing that was run before I started speaking, bipolar affective disorders, it has two sides, the lower pole and the higher pole. And to simplify it, people just know about depression and mania. There are other things that could affect us in between this. And so we talk about hypomania, we talk about persistent mood disorders. There are various forms of affective disorders that could happen. Depression happens to be one of them, and mania happens to be one of them at different other poles. One is on the high side, the other one is on the low side, and they are quite treatable, and people suffer them even in Nigeria.
Right, we must say a very big thank you to Dr. Tayo Damola, a psychiatrist who joined us from Abuja to talk about these issues of mental health. We're still expecting your call and your feedback, just in case you have one or two comments or questions. Feel free to do so. The numbers are now on the screen. You can also interact with us on social media using the hashtag Galaxy Today. Just before we go to Ibadan, Joseph, you just heard from the doctor. A whole lot of Nigerians actually go through the same issue, and most times they will not want to go and see a psychiatrist or a psychologist.
Well, that's really sad. We have a culture of not taking action until it deteriorates, until it becomes really worse. And that's the reason, for example, why you see people just drop dead due to heart failures and all of that. So I think the reason for checkup is not, some people complain about money, but in the long scale, in the long line, you look at health is far better than some other issues we complain about. So I think it's a culture we need to develop, taking care of our health, going for checkups, and we should try to make it habitual.
Okay. All right, a lot of people are still trying to call. Okay, maybe we'll open the lines in a bit, but Someone is asking a question. I would ask our doctor in Ibadan when we connect with him. He's asking if autism is a mental health problem. I would answer that in a bit, but let's take another quick background information on mental health. I will come talk some more with our doctor to join us again.
Did you know that every year, 1 adult in 4, along with 1 child in 10, will have a mental health issue? These conditions can profoundly affect literally millions of lives, affecting the capability of these individuals to make it through the day, to sustain relationships, and to maintain work. Today we celebrate World Mental Health Day. World Mental Health Day was first celebrated in 1992. The goal is to help raise mental health awareness. Each of us can make a contribution to ensure that people dealing with problems concerning mental health can live better lives with dignity. The stigma attached to mental health causes a damaging, albeit ill-informed, attitude, making it more difficult for those affected to pursue help. The best way to deal with this stigma is through facts and a better understanding of mental health problems. From identifying the causes, pinpointing solutions, and ultimately recognizing what we are really dealing with. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Adolescence and the early years of adulthood are a time of life when many changes occur. For example, changing schools, leaving home, and starting university or a new job. For many, these are exciting times. They can also be times of stress and apprehension. However, in some cases, if not recognized and managed, these feelings can lead to mental illness. Depression is the third leading cause of mental disorders. Early warning signs of mental health disorder include eating or sleeping too much or too little, pulling away from people and usual activities, having low or no energy, feeling helpless or hopeless, smoking, drinking or using drugs more than usual, feeling unusually confused, forgetful, on edge, angry, upset, worried or scared, yelling or fighting with family and friends, experiencing severe mood swings that cause problems in relationships, having persistent thoughts and memories you can't get out of your head, hearing voices or believing things that are not true, thinking of harming yourself or others. The most common types of mental illnesses are anxiety disorders, mood disorders, and schizophrenia disorders. Anxiety disorders are the most common type of mental illness. The individual has a severe fear of anxiety, which is linked to certain objects or situations. Most people with an anxiety disorder will try to avoid exposure to whatever triggers the anxiety. Examples of anxiety disorders include panic disorder, phobias, obsessive compulsive disorder (OCD), post-traumatic stress disorder (PTSD). Mood disorders. These are also known as affective disorders or depressive disorders. Patients with these conditions have significant changes in mood, generally involving either mania, elation, or depression. Examples of mood disorders include major depression, bipolar disorder, persistent depressive disorder. Schizophrenia disorders is a highly complex condition. Schizophrenia normally begins between the ages of 15 and 25. The individual has thoughts that appear fragmented, and they also find it hard to process information. Treatment of mental health disorders are psychotherapy, medication, self-help, which is basically lifestyle changes such as reducing alcohol intake, exercising, sleeping more, and eating well. Positive mental health allows people to realize their full potential, cope with the stresses of life, work productively, make meaningful contributions to their communities. So if you notice any abnormalities with you, seek help today. And remember not to stigmatize against anyone who has mental illness.
Being objective and impartial is our priority as we bring you the latest news on the front burner, and then we get you to talk about it too. Please join us as top editors analyze stories that made headlines during the week. Every Saturday between 1 to 2 p.m. on Editors Forum on Galaxy Television. Do join us then.
What would you rather be watching during your lunch hour? Galaxy Television bringing to you a program that brings you closer to social media, trending stories,
agenda like you just read out.
breaking news.
There is nothing happening in Kogi beyond the government house that suggests that a governor who is responsible to the people is in charge of what
Issues that affect you and family. The Bars, showing from 12 a.m. to 1 p.m. Monday through Friday. It's entertaining, interactive, and buzzing. The Bars, the program that keeps you glued to your television.
Yes, it's finally here. Galaxy Digital Communication Network, the latest digital outside broadcast company in Nigeria, with its modern state-of-the-art vehicle equipped with a 4-play slow-motion instant replay system and a software-based H-input vision mixing system. Transmits live events like sports, political campaigns, concerts from Abuja to Lagos, Kaduna, Port Harcourt, and all parts of Nigeria. Transmit these live via satellite to the entire world. Equipped with 8 digital cameras and highly skilled engineers, Galaxy Digital Communication Network will guarantee your best affordable and best viewed outside live event. For contact, call Bennett on 006 921 7414 or Afis on 002 303 6584 or 0818 666 6662.
Anytime you look at me with that eye, I die inside of me. I'm sorry the way you found out. But how was I supposed to know he was going to tell you and the others?
You and Dad are not the parents who used to know. Honestly, Mom, we're just one hell of a pack.
Don't bring nature into your personal motive. There is no vacuum. I never stopped loving you, and I will fight for what belongs to me.
I'm fed up of all the dramas and problems going on between Mom and Dad in this house.
I don't work like this. I don't like this fire brigade approach to dealing with issues.
You guys seem to forget who called the shots here. No procedure is rigid in the policy execution of this organization, and I happen to be the one that execute those policies.
You, Jonathan, you are my problem. You will compile it when I say you will, or you and I are going to have serious issues.
Did you know that every year, 1 adult in 4, along with 1 child in 10, will have a mental health issue? These conditions can profoundly affect literally millions of lives, affecting the capability of these individuals to make it through the day, to sustain relationships, and to maintain work. Today we celebrate World Mental Health Day. World Mental Health Day was first celebrated in 1992. The goal is to help raise mental health awareness. Each of us can make a contribution to ensure that people dealing with problems concerning mental health can live better lives with dignity. The stigma attached to mental health causes a damaging, albeit ill-informed, attitude, making it more difficult for those affected to pursue help. The best way to deal with this stigma is through facts and a better understanding of mental health problems. From identifying the causes pinpointing solutions, and ultimately recognizing what we are really dealing with. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Adolescence and the early years of adulthood are a time of life when many changes occur. For example, changing schools, leaving home, and starting university or a new job. For many,
Welcome back. It's still Galaxy. Today we are going straight to Ibadan, where we're joined by another psychiatrist from the University College Hospital, Ibadan. He's a senior registrar at psychiatric department. Many thanks for joining us, doctor. We're looking at the issue of mental health, and we've talked extensively concerning signs, symptoms, people looking normal and acting abnormally, people looking abnormally and acting normal, it's just a blend of everything. But in your opinion right now, as Nigerians mark this day, what would you advise all of us as Nigerians, looking at what we're going through, what should we be doing as a people so that our mental health will be intact?
Very much. I'm Dr. Shino Fakunle. I'm a senior
Recommendations are what we should be doing as a people as we celebrate World Mental Health Day today. What do we need to do? What do we need to put in place to make sure that our mental health is intact? Still having issues, connecting with, Ibadan. All right, Joseph, still talking about this issue. It is a serious concern. You talked about people, dressed all, well. At the end of the day, right, they're always acting abnormally. Sometimes you tend to want to give them the needed, attention. At the end of the day, they tend to tell you off. How do you handle such situations?
Well, I really don't know. Sometimes I try to run away from such people because, of course, mental illness has some sides to it. Some people can be violent, but I try to run away from those people. But the thing is, I think it's bothering me as it's bothering many Nigerians. Many people seem to have this problem. I just said something in my introductory speech that we have about 21.1 billion Nigerians suffering from one form of mental illness or the other. It does appear to me that we don't have the capacity to deal with these issues, and we have less than 200 psychiatrists in Nigeria, and that's really poor. Come on.
Very, very poor. Let's try and reconnect with Dr. Funke Fakunle, Senior Registrar, Department of Psychiatry, University College Hospital, Ibadan. Doctor, let me repeat the question I asked you, just in case you didn't really hear me well. Looking at the situations we have in Nigeria, the realities that we are facing in the country, what mental health day is today, what would your suggestion be, your advice to Nigerians, so that they can actually have their mental health in check? What should they be doing, really?
Please, I just want to say that my first name is Shino, not Funke. I'm Dr. Shino Fakunle. On today's World Mental Health Day, I want Nigerians to realize that their future lies in their hands. Their mental well-being actually lies in their hands. If the political atmosphere and the social atmosphere is conducive for them and there are no stressors and factors that predispose one to develop mental illnesses like depression, then Nigerians are going to be less likely to be at risk of mental illnesses. In addition, for those who are already on treatment for mental illnesses, they will be able to afford medication for treating these illnesses if the economic situation of the country still boils down to the politics and economy. We need leaders who are concerned about the psychological well-being of the masses, leaders who are concerned about the well-being of the youth, who are going to make sure that jobs are available, who are going to make sure that salaries of workers are paid, because all these have been identified to be risk factors for mental illnesses like depression, particularly in women. So we just enjoy Nigerians, particularly youths, that it's in the hands of all of us to work together to make sure that the mental illness is addressed and the prevalence is reduced in our society. And in addition, stigma and discrimination too also needs to be addressed. When people are said to have had a mental illness, the way people relate towards them change. They don't talk to them. They begin are hostile towards them. It's not so.
Well, I'm afraid that as much as we can take from our end in Ibadan. We seem to be having a distorted connection. I want to say a very big thank you to Dr. Shina Fakunle, who joined us from Ibadan. He is the Senior Rector, Psychiatric Department, University College Hospital. Earlier on, we had Dr. Tayo Daramola, another psychiatrist who joined us from Abuja. In all of this, one thing or two things were just strong. They were resounding there. As much as possible, try to see a medical, practitioner, a psychologist, a psychiatrist, over time, just to be sure that you don't get to the extreme, because a whole lot of people are battling with one form of depression and they don't even know about it. And then again, the second point was we should stop stigmatizing against those with mental issues.
Yeah, it's rather unfortunate we didn't get a chance to ask about the treatment options.
Yeah.
But there are various ways of treating these problems. Some people would go the orthodox way, some people will go the traditional way, and some people will even tell you that just go for deliverance. You'll be healed or you'll be cured. But some of all